My name is Dr. Eric Humble. I'm a board-certified plastic surgeon. I work here at Sugarland Face and Body Plastic Surgery. We also have another name. It's called Houston Dermatology and Plastic Surgery because of our continued expansion in the Houston marketplace. Today we're going to talk a little bit about a tummy tuck, otherwise known as an abdominoplasty. We'll go through a difference between a woman's tummy tuck and a man's tummy tuck, and then briefly mention what a mini tummy tuck is because I get asked that question a lot. So the first thing that we're going to talk about is a tummy tuck that we usually perform in women after they've had their children. And so we're going to go over some basic anatomy, and then we're going to talk about the changes in pregnancy, and then we're going to talk about what a tummy tuck does, and then we're going to talk about how it's used with liposuction. So the basic anatomy is I pass a pen through my belly wall. I'll pass through the skin, then the fat, then the muscle, and then their guts. So back behind the muscle, back by the guts, is where your babies are formed. So when a woman gets pregnant, her muscle gets stretched out, then she has a baby, and let's say she has another baby, her muscle gets stretched out again. So she's left with some stretched out loose muscle, and the guts are falling more forward, and some extra skin and fat. Sometimes that develops stretch marks at the bottom part of her belly. In a tummy tuck, what we're going to do is we're going to make an incision at the bottom down in her bikini line as low as we can. So the goal is to try to keep it really low and remove all the extra skin. So we make this incision down here, we lift up the skin and fat, drop the belly button down, go all the way up to the rib cage where we're going to tighten the muscles. Then we're going to come and cut out the extra skin and fat, pull it down, and then bring her belly button back out. So it's the same belly button, just placed in its new hole. The other thing that we have to talk about is the length of the incision, because I get asked that question a lot. If you make an incision this long, you can remove about that much skin. On a woman with some extra skin and fat in the lower part of her belly, we want to make a longer incision so we can get all the skin and fat out. Now, when you close the incision, you can remember that we're lifting up a flap between the muscle and the fat. And so that makes a potential space. So there's two different things that we can do after that to seal off that potential space. We can tack it down to the muscle, and we can go without a JP drain or a drain that drains that space, or we can leave two drains or one drain in. So that helps us seal off the space that we made. Now, when we take the muscles and we fold them on themselves, they're held with only stitches. Now, if you were to cough after surgery, you'd try to rip through the stitches I place, so we put you in an abdominal binder. I like to try to explain to patients that if they break their arm, we'll go and put a plate on their broken bone, but we don't let them walk around with the plate. We put them in a cast. My stitches are like the plate. The binder is like the cast. We also use, in a tummy tuck, we use some liposuction in various areas, especially through the flanks, sometimes the lower back, and sometimes the abdominal wall, to try to lessen the load of fat. Liposuction works sort of like if you pretend like your fat is a block of cheese, we'll pass the cannula through it and make it look like Swiss cheese and then compress it down. So if we just liposuction your belly without doing a tummy tuck, we would do nothing for the extra skin or for the looseness of the muscle. We'd only address the fat. If you have a lot of fat and we reduce the amount of fat, you'll see the skin sag because the skin won't tighten. And there's a lot of different types of liposuction, and we're going to save that for a different talk. Now, where we end our incision here and we close it, people have heard about a dog ear, which is a pooch that happens over here. So we're going to liposuction in through that, and the way that we close it is to alleviate the need for any further surgeries by not having a dog ear. Now, some people have a roll of fat that goes all around their back, so they're going to have a little bulge there no matter what you do. And sometimes they need an incision that goes around their back, or sometimes even all the way around, called a belt lipectomy or a body lift, to get rid of that. So that's traditionally a woman's tummy tuck. Now, in terms of recovery, because everybody wants to know about recovery, when you're in the binder, which takes about 8 weeks for you to completely heal your muscles, and the stitches are no longer as important, what happens is we don't want you doing any heavy lifting or exercise. We don't really want to put any stress on those muscles. So we keep your binder on for 8 weeks, you take it off to shower, and then you put it back on immediately afterwards. 8 weeks later, we'll let you come out of the binder, let you do exercise. We encourage you not to try to do too many crunches or abdominal exercises after you take off your binder, sort of ease back into it. That's a woman's tummy tuck. The recovery time from work, if you don't do any heavy lifting or exercise at work, you can be off of work for about 2 weeks. If we use drains, the drains usually come out in about a week to 10 days. You're off week for about 2 weeks and you're back to work. Now we'll switch gears and talk a little bit about a mini tummy tuck. A lot of people come in and ask for a mini tummy tuck. A mini tummy tuck is a word that usually means that we're not going to remove the belly button. So if you remember, we made an incision down here, we made this big flap, dropped your belly button down, we're able to cut out the skin above your belly button, pull it down, and then bring your belly button back out. Imagine though, if you just wanted skin cut out down here. That is a mini tummy tuck. Now, some people will say you can tighten the muscle also at the bottom of the belly in a mini tummy tuck. There's just very, very few patients where a mini tummy tuck is appropriate. That patient would be a patient with very minor skin excess and some loose belly wall that's only below the belly button, or perfectly flat belly with a little bit of extra skin down in the lower part of their belly around their C-section scar if they had one, where we're just really removing skin and fat. Shifting gears and talking about a tummy tuck for a man. We've been doing a lot of tummy tucks on men recently, and it's always nice to work on men. The thing about it is they all sort of fit similar criteria. Usually a man that presents for a tummy tuck has lost some weight, maybe even a significant amount of weight. When you lose a bunch of weight, at one time you had, remember we talked about your anatomy, so you have your muscle, then you have fat, and then you have skin, and when you lose weight, you lose the fat, but the skin just slides off. So what we do in a man is we do the same incision that's pretty long to get rid of all that extra skin, because sometimes, and we've been doing this lately, where we go almost all the way around, we lift up the skin and fat. We don't have to tighten their muscles. They were never pregnant, so they never had anything expand their muscles. Have I tightened the muscle in man? Only when there's extreme laxity, and that would be a man that had a lot of fat behind his muscle, and when he lost a lot of weight, then his muscle fell way forward. So what happens is, in a tummy tuck in a man, we lift up the skin and fat. We usually just pull down the skin and fat, cut it off, and close it. And it's also combined with liposuction of various parts of his body. So today we covered both a tummy tuck in a woman, a mini tummy tuck, and a tummy tuck in a man. We went through a little bit about how liposuction is used in conjunction with a tummy tuck to help improve our results, as well as help to take away a little bit of extra fat in different areas. Peace out.